Hello to everyone. So just a minute. I'm so sorry for this. So should we, Kristen, could you just pause the recording for once?
Yeah.
Hello and welcome everyone to this segment of COVID-19 discussions that we are having today on the International Child Rights, International Day for, I'm sorry for that. I'm really
Start
sorry
again.
for that.
I'll edit it out. Don't worry about it. You didn't
Yes.
even mention International Children's Day as well, because anyone can access it anytime, So you can just say, today we're happy to welcome you to this discussion on the topic of, and then you have violence against children and mental health, and we have with us,
Absolutely. Hello to everyone. Welcome to this segment of our discussion where we'll be talking about violence against children and mental health with specific context to the COVID-19 pandemic. We have two amazing speakers with us today, and we have Sabine and Carolina. Sabine joins us from the WHO, and Carolina joins us from the Youth Advisory Group of COVID-19. I request the speakers to introduce themselves.
Hi, Prathit. My name is Sabine Rakotomalala, and I work as a technical advisor on violence prevention at the World Health Organization in Geneva. Nice to meet you.
Hello, I'm Carolina Machado. I'm from Brazil. I work with the COVID-19 team, and I'm glad to meet you all today.
Thank you for those introductions. And I'd like to pose a few questions with our speakers today. And those questions will be related to violence against children, related to mental health during the pandemic, and several other questions which were integral during the pandemic. And we see it shaping the post-pandemic world. So my first question would be to you, Carolina. During the COVID-19, and as we saw that in the COVID-19 Life Under Coronavirus survey, many children spoke about their frustrations with not having access to child-friendly information in the early days of the pandemic. And as has been mentioned in Article 13 and Article 17 of the UN Convention on Rights of Child. Now, as a child, how do you feel about information provided to children in your community during the pandemic?
Thank you for the question. I believe that information was very poorly conveyed to children in my area. The only way we could have access to the measurements the government was taking and also to how we could prevent getting COVID and spreading it was through an online website that was very confusing, and their newspaper that is not very reachable. And also information regarding if we would go back to school and things directly regarding children were not meant for us at all. It wasn't child friendly. It was mostly for adults and responsible for us.
Thank you, Carolina, for your views. And next, I'd come to you, Sabine. And again, I'd point to the COVID-19 Life Under Coronavirus survey, which said that 21% of respondents of the survey said that access to healthcare had decreased since the pandemic. And there were regional differences, with almost 1 in 3 children in African regions saying healthcare was worse compared to 1 in 6 children in Europe. And what actions do you think governments should take to improve access to healthcare during the pandemic, especially in relation to children from the global south?
Thank you for this question, Prathit. I just want to come back on Carolina's point about access to children. I remember giving the information to children. I have 3 children myself, and there was no information for children, and we would watch the 8 o'clock news. It was confusing for adults, for everyone, for the governments themselves, for the adults, for the children. So there was a lot of mismatch of information. And I remember watching the 8 o'clock news. It was the only place where you would get the latest information on a day-to-day basis, literally on what you were allowed to do and not allowed to do. And my children suffered so much. They started crying. They had nightmares because the information wasn't presented in a way that was applicable to them. In the Netherlands, where I'm from, there's something called the Youth Journal. And every evening at 6 p.m., most of the Dutch children watch it. And it really translates news into a much simpler way for children to digest it. My daughter actually developed anxiety attacks after watching so much of this information on the news. Back to your question, Prathit. In terms of the essential health services, I do think your question about what should we be doing differently, I think there were some things that governments did very well, and they managed very quickly to adjust their governance and their coordination mechanisms. they managed to prioritize essential health services constantly in the changing needs. They did try to establish safe and effective patient flow. So making sure that patients were able to come in, get tested and go out. They tried to optimize the health workforce capacity, maintain essential medications, because of course, when you have other diseases, either long-term diseases or suddenly, I don't know, an appendicitis or a tonsillitis, how do you then access those primary healthcare services? And so they did as much as possible try to continue maintaining those. And then, of course, the health services also tried to strengthen communication and to strengthen monitoring to see what was going on in terms of population impact and who was accessing the services. So I'm just giving you an indication of some of the things that health services did try to do as much as possible.
Thank you, Sabine. Coming back to you, Carolina, another concern that was raised by children who responded to the Life Under Coronavirus survey, and which continues to be a pressing issue, is the negative effects of the pandemic on children's mental health. And we've also seen inspiring examples of children and young people taking the lead in providing peer support during the pandemic. As a child growing up during the pandemic, what do you feel are the most important ways that children and young people can support each other?
I feel like the best way to start, at least, is to communicate with your friends and also your peers. To reach out to them via text or call. You can always ask them if they're feeling well, what they've been doing, if they need some sort of support. And also being aware of the resources you can share is always great. You can share from basic Instagram pages that share positive quotes and self-care tips, to crisis hotlines and where to find affordable counseling. All of those can help prevent many sorts of different reactions during the pandemic and what affect our mental health.
Thank you, Carolina, for sharing those points. Sabine, you have a background in psychology. So what type of urgent action do you think governments around the world should take to address the unfolding mental health crisis for children?
And, I'm going to build on what Carolina said, because I think Carolina was really spot on. I would say there's three things to do. One is to engage the conversation. As Carolina said, open it up, have young people speak to each other, have professionals speak to parents, have parents speak to children. So in some schools, I know they manage really to create circles of discussion. How are you feeling? Is there anxiety? Is there depression? Is there fear? Is there trauma? And so just making it very normal, that it's not strange to go see a psychologist or a counselor. So the first thing I would say is really opening up the discussion. The second one, and slightly linked to that, is stigma. We need to remove the stigma. If you're having an anxiety attack, or if somebody's having a depression for any reason, it can be the death of a parent, or it can be just that you've watched something scary on TV, there is still stigma around it, and a lot of stigma. And so removing that stigma, to be able to go to talk to your friends about it, to talk to your parents about it, and to seek counselor, to seek help, because help at the end of the day is really the only way that you can get over mental health problems. And then the third thing I think is really the role of schools. So once you've started the conversation, once you're trying to remove the stigma, I think teachers as a front line for the children, now that many children are in school today, are a very good place for children to be able to empty their bags and then to seek help. And then hopefully teachers will then link up with referral services. And then I speak from the WHO perspectives. Many schools nowadays have school nurses, and that those are trained as well to be able to, through the school system, support the children.
Thank you, Sabine, for sharing those models and interesting points. And lastly, we also saw a surge in violence against children during the pandemic, and especially with respect to marginalized communities. And as the COVID-19 survey also noted, how children belonging to the marginalized communities and groups, including children from migrant communities, children living in detention centers, children identifying to the LGBTQI+, and children with disabilities who experienced higher levels of violence against others. How should this be addressed in the post-pandemic world, and what should governments do to address this?
Should I go first this time, Carolina? So it's a really good question, Pratit, and I think we need to be clear that violence against children happens to children around the world, regardless of COVID. 1 out of 2 children suffers from some sort of physical, sexual, or emotional violence. So it's a huge risk factor for many children. And of course, the ones that you, the subgroups, I would say that you mentioned are at higher risk. So then, of course, with the COVID lockdown, we saw huge risk factors: alcohol and substance abuse, violent parental conflict, stress due to economic uncertainty. So there was a huge increase in violence for all populations. And what did governments do? It was difficult, I have to say, to get, of course, data of an increase. Some of the data that we saw was that child helplines, I think Argentina saw a 25% increase in calls to the 144 helpline, for example. In the UK, there was also an increase of domestic abuse incidents. So there was a constant increase, but it was more through media reporting that we were able to access this information. And some governments did very original things. India, where you're from, they launched a special helpline for victims of domestic violence. In France, you could go to a pharmacy and pretend you were getting a COVID test and then say a specific word. And then the pharmacist knew that that was a code word for needing help around violence prevention. In Austria, there was special support for women and refugee children during COVID so that they could be removed and put into other households. And that was very especially targeted at refugee children. I just want to raise one more important point, which you may not know. The Centers for Disease Control just released a study that showed that 3.6 million children were affected by orphanhood. So that's huge numbers of children that are today living without their parents. And one of the things that WHO has really pushed for, I would say there are 3 things. The first one is trying to prevent deaths of caregivers, of course, through the equitable vaccines and making sure that people have access to health services. The second one is strengthening family-based services. So making sure that children are either staying in their own family-based or kinship care, or if needed, foster care. And then the third one is providing cash-based care models. So with the parenting and with the economic support, you hope that these children that are suffering, just like the subgroups that you mentioned, Pratit, are getting this type of support. So prevention of the deaths of the caregivers, family-based support, and cash care models. So those are the 3 things that we're really encouraging governments to do.
Thank you, Sabine, for sharing those really interesting facts on what's been happening around the world with regard to mental health. And thank you, Carolina, for all the insights that you've given in this discussion. And I thank both of you for your really interesting insights. And I think that the listener has a lot to gather in what has been happening on violence against children during the pandemic, and what has been happening, especially on the mental health front, especially during a time like a crisis of the pandemic, which we are currently facing. And thank you so much, everyone, for joining us for this segment. And I hope you got a lot of insights from the 2 experts that we have here. Thank you so much for joining us.